I'm Dr. Sri. I'm a primary care sports medicine doctor practicing in the United States. The anterior cruciate ligament is an important stabilizing structure of the knee joint. Unfortunately, a high percentage of patients will develop early osteoarthritis after an ACL tear. So there is no evidence to suggest that reconstruction of the ACL can prevent the knee arthritis from happening. However, there are some things that you can do to decrease the risk of developing symptomatic knee osteoarthritis. So in this video, I'm going to cover all these steps. So let's get started. So first of all, why is there a risk of arthritis after an ACL tear? So the anterior cruciate ligament is an important stabilizing structure of the knee joint. It helps to prevent excessive forward translation of the tibia, which is the shin bone, and it also provides rotational stability to the knee joint. So once the ACL is torn, the blood gets into the joint, and we call this hemarthrosis. And we speculate that the blood in the knee actually starts the inflammation cascade, thereby increasing the risk for knee arthritis. So when an ACL injury occurs, it often leads to damage to the cartilage and meniscus, which in turn increases the risk for osteoarthritis. Once the ACL is torn, the muscle weakness starts to set in, which further increases the load on the knee joint. Most ACL injuries occur in athletes who then try to return to sports, which theoretically increases the risk of further micro-injuries to the cartilage and meniscus. Even after ACL reconstruction, the knee joint loading does not return to normal based on studies. So in addition, people stop participating in being active, which increases risk for obesity. So we know that adipose tissue or the fat cells can actually act as an inflammatory molecule, thereby increasing the risk for osteoarthritis, and the weight gain actually adds more stress to the knee joint, again increased risk for knee osteoarthritis. So what are some of the factors that you can control? So as an athlete, if you want to keep playing sports that involve pivoting like soccer, lacrosse, football, or basketball, my recommendation is that you should consider ACL reconstruction. However, if you're willing to try non-surgical management and only have surgery if there are continued stability issues, then that should be fine also. Hi guys, are you finding value in this video? If the answer is yes, then this video can be helpful for many other people also. In order for this video to reach more people, I would request you to hit the like button and please post your appreciation in the comment box below. If you like this type of content, please make sure that you hit the subscribe and the notification button. Thank you. The second most important factor to consider is physical therapy, regardless of whether you're considering ACL reconstruction surgery or not. So this is important even if you're years out after an ACL tear. I would highly recommend starting physical therapy focusing on quadriceps strengthening, hip muscle strengthening, followed by core and proprioception strengthening. The key is to keep the muscles stronger forever. This is a lifelong commitment if you want to decrease the risk of symptomatic knee arthritis. So another important factor to consider is preventing weight gain. So this is a conversation that I have with all of my college football athletes once they're graduating from college, especially with those who have a history of knee injuries. Losing weight is key if they're on the heavier side. If they're in the normal weight category, I would recommend them to make sure that they do not gain weight in the future. So this is key in preventing the risk of symptomatic knee osteoarthritis. So I always recommend my patients to engage in healthier eating habits. So you should consider a diet rich in anti-inflammatory foods. The Mediterranean diet is a great option that is easy to stick to. I hope this video is helpful. If you want to know more about ACL tear, symptoms, and treatment options, then click this link here, and I'll see you in my next video. Until then, goodbye.